Every great vision begins with a blue sky and the imagination to see endless possibilities. An open mind, a keen eye, an understanding of how today lays the groundwork for tomorrow, and the boldness to give form and structure to that vision. This is how federal land was built. A natural progression from its leaders' passion for architecture. Federal Land was founded on a commitment to build communities that reflect the character of their location and the energy of the times. GT Tower International stands even taller, with a clear view of what lies ahead. Representing Federal Land's promise to build places for progress with the expertise, integrity, and care we bring into every venture. Structural integrity and strong engineering are the guiding forces behind each new development. From the time we lay the foundation of every home or tower, we harness technology and expertise to construct well-built spaces that adapt to people's changing lifestyles without compromising our standards of safety, durability, and quality. When we build, beauty and symmetry are key. We strike that elusive balance between remarkable architecture and innovative design. We are creating modern-day structural icons that reflect the country's progress. We are creating living spaces where people's days, routines, and experiences constantly take place. Where they strive to be better every day. Where connections are made and communities are shaped. As we build communities, we create distinct lifestyles that give each resident a sense of belonging. We are becoming part of a larger global community of enterprises. International brands with a reputation for quality and a vision we share. Our alliances with some of the most prestigious companies in the world have placed the Philippines in the global arena, while bringing some of the world's best within every Filipino's reach. We bring the same trust and commitment to our local partnerships with industry leaders in the Philippines. We understand that every home is a space for life, constantly in motion. That's why our presence is felt beyond construction. From a dedicated property manager that takes care of your safety and comfort, and an unparalleled living experience that will let you enjoy life to the fullest. As we build places for progress and spaces for life, our focus is clear: the Filipino. We are reshaping the skyline, one structure at a time. Imagining and building the future. With you.
In many ways, our experience over the last 2 years was transformative. While the rest of the world came to a standstill, we continued to build, create new experiences, and adapt to what was needed in order for us to recover strong together. Over the last year, SMC President and CEO Ramon S. Ang has rallied the company to landmark achievements. In January, we opened Skyway Stage 3, an 18-kilometer expressway that has effectively decongested EDSA through providing seamless access between north and south. this 7-lane thoroughfare has cut to a fraction what used to be an hours-long commute from Makati to the start of NLEX. In April, we opened the northbound section of the South Luzon Expressway elevated extension. The 4-kilometer extension links SLEX to the elevated skyway system, bringing motorists coming from provinces such as Laguna, Batangas, and Cavite directly to their destinations all the way up north via Skyway Stage 3. In June, we launched Ligtas Lahat, a 1 billion peso COVID-19 vaccine rollout for over 70,000 employees, extended workforce, and their families. To support the government's vaccination effort, we deployed nearly 200 doctors and nurses to local government sites. The program eventually helped administer 1.5 million COVID-19 vaccines nationwide. We continue to invest extensively on employee health. And over the last year, we have installed brand new CT scan and stress echocardiography facilities, as well as general ultrasound equipment at our full-service clinic and laboratory located at the head office. We launched the 2 billion peso Pasig River Cleanup Project with the goal of extracting 600,000 metric tons of waste per year. In July, we announced that we were ramping up investments in renewable energy while installing battery energy storage systems nationwide to help power our country's transition to a decarbonized future. This was followed by the unveiling in August of our plans for the Airport City, a project envisioned to be the pace setter for green, inclusive cities in the country.
Together with our new Manila International Airport project, we are looking forward to building a mixed-use airport city that is safe, clean, where people can easily access everything they need. And like the airport, it will be a legacy project, something that our generation will build to benefit many future generations to come.
We kicked off our anniversary month in September by taking delivery of the first batch of MRT-7 trains. This mass transport system will serve thousands of commuters from North Avenue in Quezon City to San Jose del Monte in Bulacan and is seen as key to helping drive a strong economic recovery post-pandemic. Despite continuing uncertainties, our progress is a testament to our unwavering commitment to deliver on our country's goals. The work to accelerate our infrastructure development, boost our economic growth prospects, and invest in a better future for all drives us. For us at San Miguel, every day is a time to build.
Sampung mga daliri, kamay at paa, nanginginig na mapanhid sa tiyan na malamig.
Chronic hunger may lead to anxiety and depression. Sama-sama nating labanan ang gutom sa Hapag Movement.
Hello, welcome to Business World's one-on-one interview series on innovations reshaping the future of key industries. Today, we tackle the topic advancing healthcare by boosting the country's biotech and pharmaceuticals industry. Lately, the Social Weather Stations has released one of its latest quarterly surveys showing a growing number of respondents, a record high 83%, hopeful that the worst is behind us in this COVID crisis. So, where is biotech and pharmaceuticals at this stage of the crisis? Here to talk to us about this is the president of the Pharmaceutical and Healthcare Association of the Philippines, or PHAP, and general manager of Roche Philippines Pharmaceuticals Division, Dr. Diana Edralin. Dr. Edralin took up the reins of PHAP just 4 months ago. So, at a very strategic time, now that we are in a transition with the pandemic hopefully at its tail end. Welcome to this interview, Dr. Edralin.
Hi, Willie. Thank you for the invitation from Business World, and thank you for the opportunity to discuss this very timely and a very important topic that you have just mentioned.
All right, perhaps we can just start with an updated overall picture of your industry. How did the pandemic affect the development of biotech and pharma in the Philippines? Let's start with that.
Yeah, so I think it's very evident, right, that over the last 2 years, the pandemic has provided us an opportunity to live up to our purpose using innovation to save lives and address COVID-19 and other pressing health challenges, Willie. So its immense impact on the people and the economy actually compelled the biopharmaceutical companies, including Roche, right, to where I belong, to harness our scientific expertise, technical skills, manufacturing capacity, distribution, and partnership capabilities to develop and make available innovative diagnostics, vaccines, and treatments for COVID 19 at historic speed. So prior to COVID, vaccines really and medicines usually take around 10 to 15 years to develop and be approved for use. Um, because it varies, right, depending on the approval processes, depending on the countries. But with COVID, you will see that for most of the countries across the world, the vaccines were able to reach patients in less than a year, and treatments for mild to severe COVID were actually approved in less than 2 years. All these are unprecedented milestones in the biopharmaceutical research and development.
Right. So, what do you were the key innovations in these past 2 years? And also, at this point, how do you see biopharma innovation in a post-pandemic setting moving forward?
So in the past 2 years, you've seen that the vaccines, right? So have taken, well, the anything that's COVID related, specifically the vaccines and the treatment, have taken the center stage, right? Actually, it has the last 2 years. What has been most critical is, again, it's telling us that all of these, right, these innovations are actually very critical to the in terms of addressing and recovery from this pandemic is very critical, but it also tells us that we can actually move mountains. So as mentioned, the vaccines and the treatment have been made available for the Filipinos. That has been at the forefront. But also at the same time, I'd like to share with you that beyond COVID, we have made specific innovations around chronic illnesses. Specifically, for example, cancer. We have made significant breakthroughs that have transformed several aspects of cancer care. And some cancers can now even be described as curable or treatable as a chronic disease. Additionally, we've also managed to maximize opportunities in terms of the delivery system. So you will see that, for example, in diabetes, there have been more advances in terms of how the modern insulins are these pens are actually not just basically doing injections, but can now record the date, time, and the amount of the previous doses, so that the patients and healthcare providers can see exactly how much insulin the patient last took and when. So these are a couple of examples, but in total, Willie, we have had, I would say, more than 25 new molecules approved in the country. So that means that even the Philippine FDA is not slowing down in terms
Mhm.
of making available medicines, again, critical medicines to treat critical illnesses in the country, and also additional indications. So there have been more than 50 additional indications. This means that existing medicines can now be used uh, also for other diseases, or in combination with other therapies, again, to be used for other medicines. Sorry,
Well,
treatment
yeah,
rather.
right. Let me just take you up on that. In March, when you took over PHAP, you, if I remember right, you did mention that one of the priorities for you or for your group will be to bring in new medicines. Can you talk more about that? What kind of medicines are we talking about?
So there are a lot of medicines. So I think in terms of the specific therapeutic area, so we will see that, let's say, starting 2018, actually, Willie, there have been at least more than 82 new medicines were launched or made available for the Filipinos. Well, there are currently more than 8,000 compounds at different stages of development globally. Again, specifically for cancer, immunology, neurologic diseases, gastrointestinal diseases, infectious diseases, as mentioned earlier, diabetes, respiratory illness, musculoskeletal diseases, and even ophthalmology in rare conditions. Again, it just tells you how the biopharmaceutical companies continuously invest in research and development to basically address, again, treatments. As I keep on emphasizing, cancer used to be right. It's actually considered as a terminal illness, but some cancers are now being described as even moving towards a chronic illness.
Well, it's nice to know that despite the pandemic, this COVID crisis did not sideline the chronic and other illnesses. Um, but going back to your industry, when what do you see are the main challenges now for your industry? I mean, what are the major risks that you are preparing for?
Yeah. So before I go to the challenges, Willie, I'd also like to emphasize, of course, the opportunities, right? The
Mm,
opportunity
yes.
for us really is, healthcare continues to, be an important aspect of our recovery, not addressing healthcare has clearly demonstrated that it will have detrimental economic impact if we don't focus on that. So this means, like, to respond to those challenges, we need to continuously invest in healthcare. We need to continuously invest in innovations and enabling policies that enable
Mhm,
for innovation to
mhm,
thrive, becomes critical. So the challenges are actually related to the industry at risk of not being able to fulfill our mission and responsibility in the society to its fullest extent, and which also leads to sustainably developing medicines to better the lives of the Filipino people. We while we study and develop medicines, these medicines also need to reach the people in order for us, all of us, to actually benefit from them. So let me highlight maybe three challenges for you. The first one will remain to be an out of pocket market, which means that Filipinos have to pay from for our own medicines. And as mentioned earlier, this means that healthcare and treatment are actually out of geographical and financial reach for many. This is not the case for many countries in the world and puts us in the Philippines at a disadvantage. There is a need for the government to support medicines for the people, because this will ensure that the people from different walks of life, whether you're a farmer, teacher, or a doctor, have ensured supplies of medicines, especially when we need it the most. So there are have been examples, in the last year we have been actually hit, or have been there have been implementations around mandatory lowering of the prices of the medicines. So, unfortunately, mandatory lowering of medicine prices is not enough, as we know that many of our people are actually in the lower socioeconomic classes. So, they're not actually able to afford the medicines even at a lower price. As the household budget, for example, of an average Filipino is mostly spent on food, versus, for example, in the UK, wherein only the spending for these expenses are only 10%. Price control policies are imposed mostly without, unfortunately, the voice of the industry. Also discourage investments in the country, as the business size also becomes unpredictable and unrealistic. The second point I'd like to make, Willie, is when governments procure medicines for people. Uh, it's a challenge that's not being addressed, because when we do that, not only that they are able to provide for the lower socioeconomic classes, they are also able to use the volume procurement to help provide an advantage for a lowered price, or ensure a secure supplies for the time they procure the medicines. um, and granularly, there are also push and pull incentives. I'm talking now about the challenges in our policies. These push and pull incentives for innovator companies, basically what we want is to welcome more investment, so that a lot of again, either local or global companies can basically making it easy to invest specifically on innovation. So let me cite some. So push incentives, for example, include research and development support, so that more of us can easily conduct clinical trials, do priority reviews for registering new medicines, and even diagnostic solutions, and even highlighting strong intellectual property provisions. Pull incentives, on the other hand, include government support for medicine purchase and the use of electronic data for patients, making it easy, especially for the government and other payers, even the HMOs, to understand more clearly where the needs of the patients and how to best get them. So faster timelines and approval process, let's say for example, in a Philippine national formulary listing, will also make it allowable for government agencies to purchase these medicines, which is actually a priority to provide better business environment in an industry that serves the interests of patients and the population in general.
Dr. May, I just want to pedal back to, because you already mentioned it, this issue of pricing. As you know, inflation right now is
Yeah,
a major problem, not only here
it
but
is.
abroad. No? So, could you just tell us how your members have been affected by this? That's number one. Number two is this thing of affordability and accessibility for all Filipinos of at least the medicines that are really in demand. No? That's always been a problem. So how do we address that amid this kind of uh, environment of really fast rising inflation?
Yeah, Willie, I'm glad that you raised that point, right? So, as mentioned, when you have drug price controls, and then on top of that, the operational costs, for example, brought about by inflation because of these fuel prices, becomes like a double, triple whammy for us. But most of the PHAP member companies, we have done our best to actually absorb the impact of the inflation, so that, like you said, we try to cushion the impact of the inflation to the patients. That's again our commitment to society. However, like you said, the sustainability of cushioning the impact of inflation to directly to patients is something that's going to be difficult, again, without the things that I've mentioned to you, because we do have the tools in place that can actually help inflation or the impact to the patients be actually minimized. Because, to be honest, I don't know for how long we can actually hold on to that, because definitely when most of these medicines, for example with Roche, we import it all the way from Basel, Switzerland, or Germany. Definitely it has definitely jet fuel prices will actually impact the operations, even the ones that all the way, so once they have arrived here, all the way to the distribution, all the way to the hospitals and even the provinces. So it's really on top of the other. So it has significantly impacted us, to answer you
Mm-hmm.
directly, Willie.
Mm-hmm.
But like you said, we are doing extra measures to cushion that, to minimize that. And then the other question that you've mentioned is around, sorry, can you please repeat that?
Oh, how do you, well, it's a perennial question of how we, well, in the first place, how have prices of medicines that are widely in demand, how have they been in the past 2 years, and how do we keep them affordable?
Yeah, so to that question, I think I've addressed it as you mentioned. So
Mm,
we try to minimize it. If there have been increases, they are very, very minimal.
mm,
As I mentioned, there are also, I would say, tools in place. For example, in the Universal Healthcare or the National Integrated Cancer Control Act, rather, there are provisions that I kept on mentioning: central procurement, because that will
mm,
guarantee volumes and allow for the government to have negotiations,
mm,
so that in the end, like as I mentioned, it's we can have that. We can minimize, especially if it's guaranteed and predictable in amount, then we can actually streamline some of these processes as well, to help, as one of the ways to help control the inflation.
Can I just go a little bit micro for a moment, and can
Sure.
you give us a picture of how Roche itself has been doing in the Philippines in these past 2 years? Could you give us a picture of that?
Yeah, so I think, like other PHAP members, really, the peak contraction in the prescription market at the height of the pandemic industry has been, something that we have been suffering from. So the
Mhm,
industry actually experienced four consecutive quarters of contractions of around
mhm,
22%. So the overall decline, obviously, in the hospital patient volumes, driven by this COVIDization of healthcare facilities and fears of contracting severe COVID, has put it down up to 72%. And as
mhm.
mentioned earlier, we have also been challenged the mandatory price regulation,
Mm.
because again,
I'm sorry,
studies have.
doctor, you were talking about 2021. Was that for
Yes,
2020?
yes.
Okay, okay.
Sorry.
I'm
Yes,
sorry.
I'm talking
Mm.
about
Okay,
2021. So
okay.
because that's the data that we have at the
Mm.
moment, Willie,
Okay,
and I think for the year it's still very much raw. So we
okay.
still can't predict that, but the trend is there, right? So mandatory, as mentioned, mandatory price regulation has also impacted us, because it did not reach again the volumes that it
Mm.
actually was initially intended for. But the good news, I want to focus on that. The good
Mhm.
news is that Roche is committed to continue research and development and healthcare investments globally, and
Mm.
especially here in the Philippines. 2 weeks ago, Willie, we have been visited by Bill Anderson, the CEO of Roche Pharmaceuticals. And I guess that's a very clear indication of how
Yeah.
much interested Roche is in terms of understanding the healthcare needs. He actually visited the corridors of Philippine General Hospital, again giving him a view of the reality that has happened. Again, PGH being at the forefront of um, COVID management in our country for the last 2 years, but also at the same time continuing to be at the center as well in terms of addressing non-communicable diseases, specifically their Cancer Institute. Because remember, cancer treatment cannot delay whether there's COVID
Mhm.
or not. And then
Mhm.
also he also went to visit the Eye Center Institute when most of the research and development are actually happening. So we are in a scenario in terms of seeing the opportunities of the present need brought about the
Mhm.
pandemic, but
Mhm.
also at the same time continuing the initiatives that we have had so far in terms of continuously investing on what patients need today and what also patients need next. And on top of that, I'd like to highlight, if you'll give me the opportunity, Willie, in terms of what also Roche is doing as far as making sure that it's only not about the innovation around introducing new medicines, but how innovative we have also been in terms of making sure that the systems in place, as I mentioned to you, the medicines can actually go to directly to the patient. So one of the initiatives that we have done so far is, we call it the Mission Leapfrog. So Mission Leapfrog is actually intending to make sure that, because basically an issue prior rather to the pandemic is that the patients are not able to access the healthcare services and treatment. That's already a given. And then it was actually exacerbated by the pandemic. So we're still living with the statistic that, for example, 6 out of the 10 patients die without seeing a doctor. And cancer as a disease in the Philippines, we're actually largely unprepared for that. So many of the PHAP companies, such as Roche, are working to address this basic need. So what we have been working through the pandemic is to reach women, particularly the teachers of Tacloban City, to screen them for breast and cervical cancer, which are the two leading cancers of women, especially here in the Philippines. So, in collaboration with our partners, such as the Tacloban City Health Office, the Department of Education, and the Eastern Visayas Medical Center, we are trying to build a fully supported referral system, making it easier for women to get educated, to know and when to get health care, and when to have and how to actually get funding and psychosocial support as they go through this journey. And on top of that, if I may add, we have also managed, Willie, to invest more in the digitalization, specifically on online consultations. We have been very supportive of that as an industry and also with Roche. So telemedicine services, online registrations for vaccination and training, knowledge sharing among HCPs, and even capability building. So, but digitalization, but also not must also not stop with online consultations and registration. And there's an opportunity for us to also to create robust electronic medical records, which Roche has also been investing on, which could support patient and medical decisions, and also improve pharmaceutical supply forecasting, and even accelerate evidence-based research or policies.
Right. Well, actually, you answered my next question, which is, so what has changed for your company? So, uh, going back to your remarks in March, I do remember also that I think you talked about the need for more collaboration between the government and the private sector. And uh, for you, what are the priority areas for public-private sector partnerships?
Well, the top of mind for me, Willie, is again the opportunity for us to, number one, making sure, right, that specifically universal healthcare becomes a reality for every Filipino. I think that is a very obvious one for us, and even the National Integrated Cancer Control Act. That is a very important area for partnership where we, again, all of us with different expertise, with different strengths, can and also, I would say to put that partnership in place to make it happen, to make it a reality today, and not wait too long anymore in making that UHC something that's tangible for the Filipinos. That's first. The second important area for partnership is again on research and development. One of the strengths that we have, most of the impression is usually investing towards manufacturing, which is great, but also we do have a strength. We have, world class physicians. We have the patient volume. We have the population. We're 110 million Filipinos. Well, perhaps most of us are still here, but some of us moved to other countries. But still, we have the population to actually um, that are actually foundations of how we can become a center of biopharmaceutical innovation and center of excellence when it comes to clinical trials. And I think the third one is around making sure again that these policies, partnerships in place will allow for innovation and continuous healthcare investments to thrive in the country.
How about prospects for manufacturing our own vaccines? I mean, this has long been a major weakness of ours, right? I mean, there was some hype, I think, last year about a number of companies that were interested, but after that, uh, has there been any progress on this front? I mean, are there any obstacles?
Yeah, so I think in terms of the opportunities, right? So as mentioned to you, there before, let's say again, these the biopharmaceutical innovation, or at least the infrastructure that's needed, requires a lot. And always the question is, do we have the foundations? Do we have the policies in place that will incentivize for these biopharmaceutical manufacturing to be to actually be easy, right? Or does it also involve years to actually build up those manufacturing sites? That's the first question that we need to ask. The second is, how are we also because how are we also making sure that there are continuous investments on capability building? Because once you have the infrastructure here, are the Filipinos ready? Do we have the right do we have the scientists? Do we have the right chemists to actually make sure that that can be done here? So those are the questions that I'd like for us to reflect on. And also now, if it's there, do we have the capacity, like you said, the how to incentivize for this to become sustainable in the long run.
Okay, throughout this conversation, you kept on going back to the issue of policies. We have a new government, so there's a new opportunity for policies. Um, what are the key improvements in healthcare that you would want delivered in the next just 6 years, and what is doable or what is achievable in that time? Are there any policies that you would want the new government to adopt, specific ones?
Yeah, so there are actually low hanging fruits, and I've
Mm.
mentioned that really the new administration would best make the universal healthcare in the Philippines a reality. And what a feat would it be if a farmer in Tacloban can be confident in his government that it will take care of him even if he has cancer, that he will be provided with a good chance to live and his family be protected from financial hardships. And how excellent would it be if our teachers, who are mostly women or mothers, not only of their own children, but also the children that they teach in school, are protected from breast or cervical cancer with screening and vaccination if needed, that they have access to the appropriate treatments. It is doable, really. And we are committed to work with the government to find ways to operationalize universal healthcare. If we can do universal healthcare for cancer, what else can we not do it for? So that's I think that's the most important thing. But of course, in addition to that, I think greater public investment in health is very important. So the National Weather Station survey, as you mentioned, released in March, found that nearly all Filipinos believe that it's the government's responsibility to provide free medicines to patients who need them. So the government is working to provide free or subsidized medicines, and this is an area where we at PHAP could continue to support them by including the creation of drug benefit packages, both for inpatient and outpatient. And um, I think lastly, right? So as I keep on mentioning, how we can actually make these doable is to establish Philippines as a center for biopharmaceutical innovation by establishing policies that will be conducive for research and development and healthcare investment.
Yeah, if I could just insert this also, I'm just curious, is there
Sure.
any country that could be a model for developing your industry at our level of economic development?
Yeah, so actually in Southeast Asia, we are now, I think we're now at fourth
Mm.
in terms of research and development. I think we're
Mm.
coming after uh, sorry, Singapore, Thailand, and Malaysia, and now Philippines is the fourth. We used to be second actually in Southeast Asia. So there are tangible examples, especially from our neighboring countries, why they become now more the preferred. I would say centers for research and development. And I think it will be super helpful for us to learn how they were able to provide again policies, and how are they, but most importantly, how they were able to implement those policies that will allow for research and innovation, research and development that will allow for more innovations to be made accessible in the country.
All right. Well, just to close this, I'd like to know your views on how do we prepare for the next pandemic, which, if we were to follow best practices of always preparing for the worst, no, the next pandemic, some are saying, may be even worse than this one. How do we prepare for that?
That's a great question, because I think you will see that there are a lot of looming potential pandemic if you look
Mm,
at in the news right now.
mm,
And I think we need not look far, really. There have been important lessons learned from the pandemic that we can actually apply in the future pandemic, but also can be applied to improve healthcare. First, as we have just discussed, partnerships to accelerate research and development and manufacturing. So no one sector can do it alone. Trust and collaborations would be essential to address as other enemy diseases or potential pandemics um, can actually be addressed. And we need to establish the country as a regional hub for biopharmaceutical innovations. um, and then the second is, how do we advance market commitments to support, to your point earlier, support manufacturing scale up for global pandemic response? Market commitment can help source secure supplies and lower prices, especially through negotiation and bulk procurement.
mm,
The third is, again, innovation is essential for preparedness and response. There is a need for us to encourage and incentivize innovation. An environment conducive to innovation, where there are predictable policies and minimize, again, price regulation, among others, will
mm,
be essential. And recognizing the value of clinical trials will also encourage innovation and investments, because clinical trials really are actually your first way to actually access innovation.
mm,
And the fourth one is, again, this regulatory agility and convergence guard safety and speed of access. So PHAP members and the FDA were able to manage to work together for flexible regulatory processes. So regulatory agility will allow us to access new and life-saving medicines in time for patients' needs. However, innovation is meaningless without access. So all Filipinos, whether rich or poor, must have the opportunity to access these new medicines.
Well, I'm just curious, have you submitted a list of recommendations to the new government, your group?
Yeah, so actually, recently, the Pharmaceutical and Healthcare Association of the Philippines met with our new DTI secretary. So I think
Mm,
and we also released our support for DTI's vision. I think that's very important. And I think we're
mhm,
also trying to get an opportunity to have this airtime with our new president, to
mhm,
be able to put forward our platform. So we can also use this opportunity to reinforce that invitation to President Marcos, if he will allow for us to share our thoughts and how we can support him in his administration.
all right, Dr. Edralin. Thank you for your insights and for your time with us today.
Thank you, Willie. I really enjoyed this discussion.
Thank you. And that ends our conversation today. Thank you for watching.
When you're out of a job and start to lose everything, for the poor and the hungry, in the midst of a raging pandemic, it's difficult to find the strength to carry on. The incidence of hunger in the Philippines has been growing every year, but when COVID-19 started and joblessness worsened, the number of hungry Filipinos grew even more, reaching as high as 38 million. All over the world, Filipinos are known to be resilient, but resiliency can only take us as far as our physical and emotional strength will allow. Today, about 15 million people in the country don't know where their next meal will come from. And for these empty stomachs, the future is getting dimmer and shorter. As the Philippines' largest telco operator, Globe aims to uplift the lives of Filipinos with kindness, care, and compassion. Driven by its purpose to treat people right to create a globe of good, the company rose to the challenge of addressing a severe problem faced by many struggling families in the country. Calling on its customers, local and international partners, Globe came up with a solution that would help address the nation's critical condition: hunger. This lifeline will feed families and individuals, including many of its disadvantaged customers. Introducing the Hapag Movement, a united fight against hunger through technology. Every 50 peso donation provides one meal, delivering support to regions with the highest incidence of hunger. But Globe cannot do it alone. The help of a broader group can bring this meaningful act to scale. The goal is to feed 500,000 Filipinos together. Let us bring back the nation's physical strength, dampened by the daily battles with hunger, to ignite the Filipino stream once again and spark hope for a better tomorrow. Sama-sama, lahat tayo tulong-tulong maghain ng pagkain. Because together, we can create a globe of good. Be part of the Hapag movement.
Napapagod ka na ba sa hamon ng buhay? Tuloy lang kaibigan, huwag kang ihinto. Bayan sulong na, bayan sulong na, bayan sulong na, bayan sulong na, bayan sulong na.
Pilipinas, sulong na.
Welcome ka dito sa SM. Come as you are. Mahilig ka man sa pabago-bago o sa paikot-ikot. Yung nag-a-adulting or parenting. Ikaw na kulot, white-haired, purple-haired, kayong magkaibigan na nagkaibigan. Buong barkada. Yung gusto mo, chill lang. Or gawin yung feel mo lang. We know you're changing. So we're changing with you. Come on in. We're all in. At SM, you're always welcome here.